We've got Anna Cleaves and Laila Namarkdan, and Anna is going to introduce both of them for us. So they're both from the UK and going to give us some updates on a range of things. So thank you so much, Anna, and over to you.
I'm going to tell you about some activism that Laila and I have been involved in. Laila has been active in women's rights throughout her life, from transporting supplies to the Greenham Common Women, who many of you will remember, to setting up Rape Crisis Centre. She's an experienced mental health practitioner, both in nursing and in advocacy. I've been a science teacher, and obviously I've promoted opportunities for girls in my professional life. I've been involved in unions, which, as you know, are incredibly misogynistic, and I'm currently involved in a project in Ghana to get girls to go back to school after the COVID lockdowns, because a lot of the girls have been recruited in the farming and household arena. I was asked in a meeting recently, what activist things have you done? Got me thinking about what was meant by activism. Well, it's any activity that furthers a cause. You are all members of an audience which is sensitised to the issue. But the webinars here have shown that many women all over the world woke up to the gender identity ideology threat very, very late, only in recent years. And we know that gender ideology is everywhere. Anne Harper Wright put it like this: gradually, people are waking up to the fact that gender is now enshrined in law in many countries, sex has been downgraded, and our legal rights are changing. And we missed the memo. It was recently reported that 80% of people who think they are the opposite sex are unemployed. A man let it slip because he couldn't afford his breast augmentations. He needed breasts to be able to pass. As what? I really don't know. The volunteer activists of gender identity ideology have got, therefore, plenty of time. So we need to alert as many people as possible to the threat to women's rights of gender ideology. WDI, as this organisation is now called, is a great resource for informing us of the issues, and we're affiliated to 418 organisations. Plenty of opportunities then. You may not be the face of the organisation. You may not be mounting legal challenges like the wonderful Cara Dansby, or women like Umbra in Spain, who started to reach out to ordinary people who were absolutely disbelieving that a law was pending to force women to accept that a man can declare a gender identity and call himself a woman. These people can be persuaded to watch the YouTube, to sign a petition, to write to their representatives, and of course they vote. Whether you are asked to participate in a demonstration, sign a petition, for example, about women's refugees, or contribute whatever you can afford. In the UK, you've heard, obviously, of Women's Declaration International and Keep Prison Single Sex. I had dinner last night with a woman who talked about Keep Prison Single Sex, and I said to her, there's a crowdfunder going on at the moment. Can you afford to put in a £5? Because if 1,000 people put in a £5, they'd have a bit of money. Transgender Trend, for parents to challenge the illegal teaching and arrangements in schools. I've alerted loads of parents to that organisation. Sex Matters, of course, have come in much later, but they've been pretty effective. We need to engage with government organisations, statutory bodies, such as the Equal Opportunities Commission, universities, and the UN, because they have power, because they have influence. The gender identity movement realised this a long, long time ago. You may not agree with many of the issues that these people defend, but it is obvious you have to inform and lobby the powerful and the influential. Now, what have I learned from webinars about transmitting this information? The debate is not about trans rights. I must avoid being derailed by gender identity issues. The issue is the erosion of women's and girls' sex-based rights. I've learned not to use the language of gender identity and to oppose it whenever I see it. 20 years ago, I would have accepted the term trans child because I didn't know any different. So, for example, some private girls' schools are sticking to their single-sex policy. So how was this reported? In the local newspaper, it was reported that the school is not accepting trans pupils. Ridiculous. The latter description of it makes the school look bad, even though the law is on their side. The government guidance in UK schools says, no child shall be taught that they can be born in the wrong body, 2018. And you can look it up, and that's on the internet. Laila and I have been involved in UK government consultations. Anyone can answer these. A recent one was about conversion therapy. The questions are dreadfully constructed, strongly influenced by groups which subscribe to the affirmation model of gender identity. I say I'm a girl, so I can go through a clinic and get my gender identity confirmed and get all the hormones and mutilations that I want. Now, your first reaction when you look at this, as was mine, is, I don't want to be involved in this rubbish. But I think we must. Otherwise, we'll be seen as not having any concerns. There's no opposition to this. One consultation question, I'll give you an example. For balance, changing a person from being transgender or to being transgender becomes a criminal offence. Really? This is another sinister attempt to criminalise the watchful waiting approach for people, particularly children, and promote the acceptance of you are who you say you are. Not only do you answer the question, you also have to point out the flaws. Now, I know that many women, many people, but particularly women, are extremely busy. But I think in the absence of women's voices that we've had for so long, we need to grab every opportunity. The WDI submission is on the website, and I urge you to answer as many questions as you can manage. The consultation is not closed until February the 4th, so that's another 13 days that you've got. Now, prior to this consultation is closed, but I'm just trying to illustrate, opportunity. It was on women's health. Now, in the introduction to the consultation, the then Minister of Health, to his credit, recognised that we have a male default model of healthcare. We realised we could bring our research on single-sex accommodation in the hospitals. Laila will explain this. Also, the rights of the child, in the light of the 4,000-fold increase in girls being rushed through gender identity clinics, pending mutilations and wrong sex hormones. This is currently being investigated. Girls' health and mental welfare are being impacted by being forced to do sports with boys in schools and colleges. The extensive medical harms of surrogacy, all well documented and very, very well evidenced, and the NHS picks up the tab. The cost to patients and NHS alike of detransitioning, and the consultation responses on the WDI website. I know that it's closed, but it just shows how you can just, use it. I mean, I don't know anything about the situation. I know that, other situations in hospital. I know that, for example, Black women are 4 times more likely to die in childbirth. But, I don't have the time to do a lot about that, but I can write about what I do know. I doubt whether the gender identity cult said anything in this consultation. So to reiterate my message, do what you can, when you can, spread the word and encourage people to sign the declaration.
The subject matter of which I'm going to engage with this afternoon is a bit tricky. It's very convoluted, but what it does show, and what I want to assert, is that the gender lobby's sleight of hand with regards to the NHS in the UK is what I would consider to be maladministration. The issues contravene the Equality 2010 Act, and they are trying and have tried for the past 20 years, quite shockingly, to replace the UK NHS recording from sex to gender, and they're being very, very successful at this until very recently when other organisations have stepped in to point this out. To just reflect very quickly on the single-sex accommodation issues and research that we did, the Equality Act 2010 makes it quite clear that sex is a protected characteristic in this country. Gender reassignment is also a protected characteristic, but single-sex spaces can be justified, and gender is not one of the 9 characteristics of our Gender Equality Act. In the 1970s and 80s, men and women in this country, through various organizations, lobbied the government at the time to reinstate single-sex wards. There were so many complaints, and this was a 30-year campaign that we were led to believe was going to be resolved. And by 2012, we had a pledge from the government, which all hospitals had to demonstrate they had it, that single-sex wards would be the most optimum that men and women could expect when they entered inpatient services of the hospital. All well and good. So the public were led to believe that single-sex was back and available. Mixed sex was no longer the issue. In 2019, however, there was a review of the policy, and Annex B was added to the guidance, resulting in the introduction of policies using the term gender identity rather than gender reassignment, which has caused utter confusion within the NHS and the way in which it's dealing with this issue, to the detriment of both men and women, women and men, girls and boys, as our research demonstrates. At this point, I am reminded, and I think we've always got to keep reminding ourselves, what is the truth? And in a recent thing I was listening to on the radio, a Sherlock Holmes mystery actually, Watson himself was in a muddle on a case. And he explains this, his muddle, and Sherlock says to him, well, when you eliminate the impossible, what's left is nothing but the truth. And so here we are. Humans cannot change sex. That is the truth. Sex is the material truth, and changing sex is impossible. So as I went on, pursuing further lines of inquiry, I wondered how single-sex accommodation had fared during the pandemic. And I found out that the data for breaches was suspended in March 2020, and then allegedly was to be resumed in October 21. During this period of time, I had picked up various complaints from women on Twitter who had shared wards, and I expect we can say, well, to be fair, during the pandemic, those sort of things would be suspended to make bed efficiency more able to cope with the influx of people. The data collection that I have seen for October 2021, there are clear breaches, and there's been a sharp spike, which we might expect. However, I noticed some research on the setting up of the policy to eliminate mixed-sex accommodation. And this goes all the way back to when the policy was first put together. And our 2011 statement setting out the policy. The data supports the collection of consistently defined data on breaches of mixed-sex accommodation, but the policy committed relates to gender, not sex. But to ensure a better understanding for the public, it was floated as mixed, referred to as mixed sex, with the abolition of mixed sex into single sex. I'm sure you're following all this because it's highly confusing. There is a confusion in the policy and in the data sets. Now, I don't know much about technological data sets that are held by computers. So you're diving into a minefield here. So there are pledges to do with single-sex accommodation, which started when the policy was written. Trans activity, we now know, has already been in there from 2010, and some people allege long before that. Some people are now arguing that this was a post effect of the Gender Recognition Act in 2004-05, that gender was now going to be considered as the major source for data collection for the NHS rather than sex. I wanted further information because I couldn't make a lot of sense of any of this. So I sent an email to the NHS Data NHS for further information. I asked simple question: how is data on single-sex accommodation collected and collated to monitor breaches of single-sex accommodation in acute settings? What information was gathered on the was the information gathered on the basis of biological sex or gender? And how was this to be disseminated and made sense of when actually using the data to plan NHS and discriminative practices that may be in the NHS regarding operations and patient care and treatment? I had a response within, well, I wrote it in the evening, and in the morning I had a response. An analytical support officer from the NHS Improvement, or the Office of National Statistics as it's now, he directed me to the NHS statistics site, and he also added Annex B 2019, because he said that would help me understand things a great deal better. And when I scrolled down, I noticed that he'd already got his pronouns in there, he, him, and his. So that was a red flag to me. All NHS funded care, which is part of the pledge, is supposed to prioritise safety, privacy and dignity of all patients, and all reporting of breaches of accommodation became mandatory and should align with the Equality Act of 2010, where sex is a protected characteristic, but it doesn't. The he, his, him went on to explain, and I quote, that the Annex B details policy to anyone whose personal experience of gender extends beyond the typical experience of their assigned birth. So now we've introduced the word assigned at birth. So what's happening? Very odd sentence. Advised on admission of a patient contained within Annex B is also rather odd. It's impossible to establish the view of the patient because he or she, note that they don't use pronoun bleakness, they don't use they, them, drawn from address. So when you don't know, if someone comes in unconscious, the first thing you must notice is what they dress like, and that gives you apparently lots of clues about who they are. We must not, we can take inferences from that apparently. We mustn't investigate their genitals, but however, so many unconscious patients in my long years of experience require catheterization. So there you are, right there, you have it. You know, you're going to be aware of the genital differences or not, as the case may be. So I then get worried about other information about things that are told that nurses have to do, and that they have to assess transgender patients on the basis of a case-by-case. And as a recent article last year in the Telegraph outlined, what nurses under conditions of any situation, whether in this country or elsewhere, has time to do case-by-case basis on people who they might have issues with or concerns about. So I responded to my interlocutor on this and asked more questions. How is data collected? Is it sex or gender? Very easy to tell me. Where can I access the format for this collection? And are patients recorded on the basis of their sex, male or female, or by their declared gender, women, men, other? And why is this deviation not called breaches of single sex, but actually breaches of mixed sex accommodation? It's a very confusing issue. So far, and this was from Tuesday this week, I haven't had a response to my further quest. The sleight of hand in which you see gender ideology influence was to make the policy about gender and then pretend that it was following the law, Equality 2010. A 30-year campaign was just pushed to one side. This doesn't make sense, and in fact is a breach of single-sex accommodation. But when gender is a marker, not sex, and biological males can now enter women's single-sex places, and nobody knows how many and what the rationale is. We don't know, because as I moved on with my consideration, I looked at data sets, and data sets have been changed over a period of years, starting in around 2004 and post the Gender Recognition Act. All data collected by the single sex now has been retired, as they call it, on the computers since February 2014. Mixed sex data collection has also ceased, and so has combined data, sex gender data has been retired, as they call it, on the computers. Now data forms part of the government statistical services. It's moved away from its original home to now being part of the Gov statistical services. Data collected on the basis of gender, one is defined, and gender assigned at birth. We've now moved from sex to gender, and we've moved from sex observed at birth to gender ascribed or assigned. And Anne Harper Wright, in her articles, which can be found on the website, very easy to collect. And as far as we're concerned, she went and asked for how her sex or gender was being recorded. She got that information, and she found that she was the identity code that was meant to be set up by the NHS to distinguish between sex and gender, because they said that couldn't be tolerated. Then it turns out that her sex is not recorded, but her gender is. So we have a gender identity, what we call codes, and the first code is male, which includes women who identify as trans. The second code is female, which is TIMS. It includes TIMS. The third one is non-binary, and the other, number 4 is other, and then number 5 is not stated. So these gender ID, and the same for birth, as I've said, indicator. Code, there's 3 codes for that. Yes, which means identified as the same gender assigned at birth. No means gender identity not the same as assigned at birth. And Z is declined to respond. So there's so much evidence out there now, fair play for women, because they have a lot on their website about all of this, which I think is very, very interesting. There is other information, but I think it's a bit late in the day, and we've heard lots and lots of really great information today, and I don't want to take up too much more time. Fair Play have challenged the government on this sex being replaced by gender. And I think it would be in our interests, women's WDI, to join in, because there is going to be further discussion about the reintroduction of sex as the marker, not gender. So Fair Play have challenged the Department of Health, has delivered recommendations for change, and the NHS have said there's going to be stakeholder engagement, which will take place at a specified time that haven't said yet. This was announced in October last year. So we are waiting, I guess, waiting to hear when this has happened, because when the Gender Recognition Act was made law, and they started to change sex to gender, there was only the stakeholders involved were organizations that had influence by trans and by Stonewall. Also, Fair Play have engaged with the Office of Statistics, the regulator, and had meetings with the Director General there to raise concerns about the necessity and the value of collecting data based on sex. And that overlooking sex is a great, great disservice to the NHS public users. This may represent a breach of the ONRS Code of Conduct of Practice, which I would have described in my opening speeches as what I would call maladministration. It is maladministration to replace sex with gender without any kind of discussion whatsoever in the public domain. And what the meeting is seeking is a unified information standard. They're also wanting to engage with the Equal Human Rights Commission, as the NHS is obliged to follow public sector equality duty and must demonstrate equal regard for all protected characteristics. And gender, as I've said previously, is not a protected characteristic, only gender reassignment. Should play a greater role in the ensuring that data collection is based primarily on sex. Could have been argued that the current data sets are discriminative on the basis of sex. The propaganda that's been around for the past 10 years from Stonewall, or since 2015, has been that sex, it's illegal. According to Stonewall, it's illegal to have data based on sex.